Hello, my name is Henok, and I'm one of the PAs working here in emergency department. Today we have a patient named John. He's 25, male, and he's complaining pain on the front of his knee. And he said that during activities such as jumping and running, the pain level increases. So based on the symptoms, I believe he has a condition called patellofemoral pain syndrome. And I'm gonna go and explain the condition to him. If you like, you can come and join us. Hello, John. So, based on the symptoms that you are experiencing at the moment and the physical examination I did, I think you have the condition called patellofemoral pain syndrome. Do you know what it is? Would you like me to explain it to you? Yeah? Okay. This condition is very common, especially in active individuals such as yourself. Because of that, sometimes it's called runner's pain or jumper's pain, and it occurs mainly because of the overuse of your knees, poor knees. Yeah, and usually it presents with the pain on the front of your knee, just like you are experiencing at the moment. So to explain this condition, I make an amazing model here. If you consider this as one of your leg, and you have at the top your thigh bone, and at the bottom there your shin bone, and in the middle you have your knee, and at the front you have kneecap or patella. And during activities such as running or jumping, the patella goes up and down, up and down, up and down like that, and within the grooves, and that is normal, healthy. But sometimes the patella kneecap deviates to one side, and that side become very inflamed and become very painful, just like you are experiencing at the moment. And especially in repetitive activities such as running, uh, just that one side become working very hard, the other side taking a day off, or taking a nap, if you like. The other side cartilage become inflamed and painful, and therefore it's important to consider different treatment options, because if it's not treated, the cartilage become damaged, and that is a very painful situation, and in the future that might lead to the condition called arthritis, and I don't think you want that. Yeah. So there are a few things you can do at all. That starts with taking a good rest. Rest is important, giving a break for your poor knee, instead of putting your weight on full your on your painful knees, taking a break, rest. And when you are resting, it's important to alleviate your painful knees, and also using compression bandage around your knees. Make sure it's not very tight, uh, so that it's not painful. That bandage is helpful for you to reduce or minimize unnecessary swelling around your knees. And the other treatment option is physical therapy. And yeah, this condition needs a little bit exercise, if I bring my amazing model back, and I'll try to explain the the importance of physical therapy. And the kneecap is normally controlled by four muscles that comes from your thigh bone. And for our situation, those muscles, the two muscles that comes from the outside and inside of your thigh are important, and because they counteract each other when you are walking or running. And for example, if when you are walking, the the right muscle, the outside muscle, pulls your kneecap to one side, and the other muscle, the inside muscle, contract and pull it back. That means your kneecap remains within the grooves, which is a good thing. But during patellofemoral pain syndrome, the inner muscle becomes a little bit weaker, and the outer muscle becomes tighter and stronger. That means when you are running, the outer muscle, the stronger muscle pulls your kneecap to one side, and the weaker muscle is not reacting to that. That means the kneecap remains to the stronger side, and that side keep working hard, and that is a painful situation. So what physical therapy does is it will help you to strengthen the weaker muscle, so that when you are walking, it will pull back the patella to its grooves, so that it will reduce the pain for you for the future. So if all these solutions are not providing us any solution, we might consider to use a surgery. And surgery is very, very, very last resort. It's not common to use this, surgery for this condition, but it is there, and it involves two things. The first kind of surgery is removing the damaged cartilage from the surface of the back of the kneecap, so that the kneecap starts moving smoothly up and down, up and down, up and down without problem. The other one is a little bit bigger surgery, which involves pulling or repositioning the patella manually to its grooves, so that it stays within the grooves without causing any pain for you for the future. And that's all I have to say to you. And does that all make sense, John? Yeah? Do you have any questions? You don't have any questions? Okay.